always wash my hands. That's the best way to break the chain, to clean, or to disinfect. Let's think of more examples of that exact question, ways they can ask it to you differently. Medical asepsis. Yes.
What would be an example of a reservoir?
A reservoir, like, shoot me, number of things. A reservoir could be a table. It's just sitting there growing on the table, like, and then I touch it and it gets on the meat. Like an area with a lot of moisture, that's a reservoir. You know, a lot of pathogens grow in moisture.
Do we have a name for all that, the fomite and all that stuff too?
That's good to know, yes. What is a fomite?
The jugs.
I think I have that one.
Inanimate.
Inanimate
Object.
object.
But that's also like the direct.
I think we're gonna go over that. I think I have all that coming up, so stay tuned.
Mr. W.
Yes.
Antigen is positive agent.
bad.
So does it come under infectious agents as well? Because it just can create infection.
What's it say right there?
So when the circle will say infectious agent, we can have pathogens.
What's it say right there?
An infectious organism.
They're synonymous.
So,
Yes.
But then it's also the fomite. Look at all that, yeah.
There we go, yeah. So some modes of transmission. Of course, we have droplet and airborne. We have vectors. This is one that people often forget. A vector is a living thing that transmits a disease. A vector. What's one of the most common vectors?
Rats. Mosquito.
Rats, mosquitoes.
Cockroaches.
Animals.
Mosquitoes being one of the biggest
Kids.
ones, like the picture right here. Kids, yes.
Kids.
Kids are big vectors. A vehicle
Kids.
does not mean your car. It means
Contaminated
something like
food.
food or water. That's a vehicular transmission. Contact, we have two types. We have a direct versus indirect. You remember how I described the two the other day? Direct, we refer to touching a living thing. Look right here. It's a great picture, by the way. Great little diagram here.
Come here, baby.
Whereas indirect is a faucet living. No, it's a non-living transmission, which can also count as a fomite. So a little overlap there. But you can fit these into multiple categories sometimes. Don't put it in just one category. Keep in mind some things are overlapping in those categories. So things like droplets, guys. Droplets are the most common droplet. The nastiest one would be snot. You know, someone sneezes. You ever see this slow motion guy sneezing and all the droplets come out in slow motion? All the little spit bubbles and mucus bubbles. That'd be droplets.
Would that be
Droplets.
direct or
The
indirect?
picture.
Well, it depends. It depends. So once again, there's gonna be some overlap. So if I sneeze and my droplets go towards you, Angelica, not to gross you out, and those droplets hit you in the face,
That'd be indirect.
that's indirect, because are the droplets alive?
No.
Oh.
But I got some snot running out my nose, and for some reason you come over and touch my face, which would be really nasty and weird, but you come and touch my nose with the mucus coming out, then it's direct because you touched me. And I'm a living thing. Yes.
I got you, Mr. Donahue.
So there's some overlap, obviously, but do y'all follow me what I'm saying? Now, yeah,
So like for a vehicle and it says food, would that be like when your food is contaminated?
yes, like food poisoning.
Okay.
By the way, if you've never been food poisoned before, one of the worst feelings on the face of the earth. I've gotten food poisoning twice, both from Taco Bell, ironically.
I got mine. I was gonna invite you.
Yeah, it is the worst feeling. Like you feel like your insides are just like dying. Like you're just like your body's trying to eliminate it, and it's just it's horrible. Horrible. Yes.
So droplets are like fluid from our body, and airborne is like sneezing, and there's like these particles coming out.
Well, there's a little overlap there, but that's why I put this right here, guys. Droplet is going to be more specific to your coughs and sneezes that can spread droplets of saliva and mucus. Whereas airborne, it's going to be tiny particles, usually by talking or suspended in the air. And they're droplets. Think about it like this: droplets are bigger, like big swabs of mucus. They kind of fly really quick and they hit something. Whereas something that's airborne kind of lingers in the air a little bit, like a mist. So it's the smaller particles. Like if I'm talking and I got some spit bubbles flying out, they're kind of lingering in the air a little bit more. I'm grossing y'all out here, but
So coughing and sneezing would be both. airborne and droplet?
It can overlap, yes. So some of these droplets are gonna shoot out, hit the table, whereas some might linger in the air. The ones that are projectile and hitting your table, that would be a droplet. The mist floating in the air, that would be the airborne.
Airborne. Thank you.
So
What are
like,
less
if you
than 5 months?
sneeze, and like if you sneeze, it stays in the air for like 5 minutes.
Depends on the consistency of what it is. It's kind of gross, I know, but you know, as we all talk right now, we are emitting airborne particles. We're all breathing in particles from each other right now.
Ooh.
As unsettling as that is, we are. As you talk, particles come out. You flush your toilet, guys, the particles from that toilet come out like a mist. You can't see it, but you're breathing in toilet particles. Everywhere you go, I'm sorry my germaphobes out there, but it's the truth. Everywhere you go, you're absorbing and breathing in particles. That's airborne transmissions. Now, that same toilet gets overflowing and shooting out big clumps of water and feces. Then you got droplets coming out. I know it's gross, but you're not gonna forget it.
Oh my gosh, you know
So-
what's even sicker? Is that your toothbrush is in the restroom.
Yeah.
Yeah, you're brushing your teeth with feces all the time.
I put mine under behind my.
If you leave your toothbrush out in the bathroom near the toilet, you're brushing your teeth with feces. It's considered
Oh,
particles.
that stuff.
I'm sorry to gross you out, but that's the truth.
That's what you're supposed
That's
to
the
cover
truth.
it.
Isn't the easiest way to stop that just to close the lid?
No, because it still comes out the sides.
But if you cover your toothbrush,
Yeah, and you get the little UV things
I
you
hope
put your
y'all do.
toothbrushes in, and there's stuff.
you need. You
But look, guys, look, as
No,
gross
see.
as it is, it's good for you. Let me repeat myself.
Don't matter.
I will do a little life lesson here. As gross as that all is, it's good for you because you're building your immune system up. You've got to breathe in this nasty stuff to build your immunity up. If you sterilize yourself, you're more susceptible to sickness. That's the truth. That's the truth. So they say when you have kids, your immune system gets better. Because kids get infected with everything. They bring it home. You get it on you. Guys, when I worked pediatrics, my immune system was so strong for 10 years, I didn't catch anything. I had like the Terminator immune system. I did not get sick. Because kids have everything. Kids are nasty. Kids are gross.
Mr. Donovan, before you change the slide,
Yeah.
what do you, please explain the box inside. Human has 60 to 120 microns wide.
Let's tell you the size of a droplet, how tiny it is. A droplet, which is white lingers in the air, is about 60 to 120 microns wide. I'm sorry, it's less than 5 microns wide. Human hair is 60 to 120 microns wide. So a droplet is significantly tinier than one single hair. That's what that's saying. Just a size comparison. You don't even know that, just for fun fact.
Are they saying that's the airborne or because
It's for
it looks-
airborne.
Okay, so on the left it says more than 5
So
microns.
the droplet would be more than 5 microns.
Yeah.
It's a larger mass, whereas the airborne is like the misty things lingering in the air, very tiny.
And the hair has 60 to 120 microns.
Yes.
It's not clean, that means.
Hmm?
The hair is not
We're not
clean.
talking about cleanliness. We're just talking about size.
That's why you find hair.
Microns is not talking about like organisms. It's talking about the actual size. A micron is a measurement.
But we're talking about the size of the infection and cough and sneeze can spread droplets and saliva. Oh, I see. It's only,
Okay, let's go over some airborne precautions. Good to know, guys, because you probably see these on a lot of patients' doors, on the charts, things like that. You gotta know what they mean. So, patients are isolated in private rooms with special air handling and ventilation systems when they have what we call negative pressure. Negative pressure, y'all seen those before? What's the point of a negative pressure room?
Contaminated. To keep
Keep
it.
the air contained. That's right. We don't want that spread. We want to keep it contained in one area. Healthcare personnel must wear those wonderful N95 respirators when they enter an airborne isolation room. You've all done this by now, I'm sure. What would be an example of an airborne isolation patient? TB, the most common. You see that? Please put a mask on, guys. It's highly contagious. Don't risk it. Patient transport must be limited as much as possible. If essential, if they're having to be moved around, the patient must wear a surgical string mask, which is kind of ironic that they only require a surgical string mask for the patient, but you as the caregiver need an N95. I think they do it both ways, but at minimum, they want you to use a surgical mask on the patients. Why? I don't know, but that's the rules they set. I don't make the rules. Healthcare personnel must wear a surgical string mask when working within a 36 feet of a patient on droplet precautions. So, once again, airborne, N95, droplet surgical mask is all you need. Why? Why is that? Airborne is referring to
The particles.
the tiny particles, so the N95 can filter that. It's a stronger, more advanced mask. Droplets are larger chunks of nastiness. Surgical mask is sufficient to block that. If you want to use an N95, you can. They're saying at minimum, that's what you would need.
Isn't that because like, cause it's airborne, so the air can go in, so you need to be.
The filter.
It needs to be tight.
Yes.
Fitted. But if
Yes.
it's just a surgical mask, I mean, it's just a droplet, so.
Correct.
So,
By the way, it's also why it's so important you get your mask fitted properly. Because if it's not airtight on your face, once again, we're talking about those tiny microns on those airborne particles. They're going to slip into the cracks. And you're going to breathe that stuff in. Yes?
If we get coughed on, does it matter that we change our mask as soon as possible? Like,
Does it matter?
like let's say N95. even
If you
it's
have
a
it airtight on your face, you're okay. You're okay. Now, I would still wipe myself down after I get done, but
But you wouldn't change your mask.
I wouldn't walk out and change my mask, no. I'm not going to disrupt the procedure like that. If I have it on
No, I'm saying like
properly-
after the fact. Like you've completed your thing.
Oh,
you
yeah,
cough on
yeah,
your
of
face.
course.
And,
I thought you meant like while you're in the middle of an exam. No, no.
yeah, I think it's really weird because like they have all kinds of patients in like the MRI machines and stuff like that, but they never clean it. Like the inside's never clean.
People are nasty, what can I say?
You know what I mean? I was thinking that. I was like, y'all don't clean the inside, and they're like, no. I was like, they have TV. Oh.
People are nasty. So people have different
can you go
opinions
back?
on hygiene.
Are you able to clean it?
Thank you.
Are you able to reach in there to clean it?
You lay on the table
Alright, what are
and someone
contact
picks the machine.
precautions?
You go in.
These patients are
That'd be
going to
so
be in
funny.
private rooms. They're always private rooms. You will not put a contact patient in an open EC with beds all near each other. They get their own dedicated room. Or they'll be cohorted with people with a similar contact precaution. That'll be the only time they're in a room with somebody else. That's what cohorted means, by the way. Like you guys are a cohort of students. Healthcare personnel, you must use gloves and gowns as indicated. As we know, you see contact precautions, you put those wonderful hot plastic gowns on. They're blue, yes? I hate those things. They make you sweat like crazy, but it is necessary. I'll come back to that in a second because you need to know a quick fact about gowning. Your hands must be, keyword, disinfected. Is this medical or surgical? Medical asepsis before and after gloving, very important. Transports will be limited as much as possible. When necessary, we take the precautions. All X-ray imaging requires special precautions and 2 radiographer teamwork. Why? What's an example of this? When I say all contact precaution patients need a team system, what am I referring to? Samantha?
You're talking about like if you have somebody that when they're taking out the cassettes and just
Correct.
for the sterile.
Y'all know what she's referring to.
Yes. Clean and dirty.
So let's say I'm on portables, I go to a contact isolation room. It's me, and I have Samantha with me. One of us is gonna be the dirty tech, one of us is gonna be the clean tech. So Samantha's gonna gown up, she's gonna have the cassette in a cover, take all necessary precautions. I'm the clean tech, I'm just gonna be running the machine. So when she's done, she's gonna allow me to take the cassette out of the bag while she cleans everything else. I'm gonna wipe that cassette down, do what I gotta do. That's a clean versus dirty tech procedure. It's a team-based approach. It's supposed to be the safest approach instead of just doing it all by yourself. Y'all follow me? Equipment must be dedicated to a single patient or cohort. Please, guys, I mean, this should be common sense, but you'd be surprised how people don't do this. All of it must be cleaned and disinfected between patients. Once again, is this medical or surgical asepsis? Medical asepsis of our equipment between patients. Now, back to gowns. When you put gowns on, what's the proper way to put a gown for a contact isolation patient? We, of course, wash your hands first, but what's the next step? Put the gloves on, right?
No. Put the
No,
gown.
what's the first thing we do? Gown goes on first. Our thumbs go in the little holes, right? Then, what do?
Tie yourselves.
Put your gloves on. Put your gloves on, then you tie yourself. Please know that order. You should put your gloves on first. You tie it around, well, you wrap it around, I always wrap it around, you tie it in the front, making sure it's nice and tight. So we just like tie it back here, but it's really loose so we can do that. So what's hand go up? Yes.
whenever I wear those contact things, I do 2 gloves, one before, one after, so that way when you're ready to, leave the room or whatever, you take one set, and you're technically a clean
I've seen
set.
people do
I've
that.
done that.
Yes.
That's good.
That's up to you.
Makes
But
me
at
feel
minimum,
better.
just the
Like
one
what's
set
doing
is
it.
considered sufficient, but you can do that if you wish. Okay, just a little bit more gold star info, guys. Now, this is a big one here. I've seen this asked in a number of forms at first bullet points. Because not all symptoms may be evident in patients affected with certain diseases, such as HIV, AIDS, hepatitis B, many other things, we treat all patients, even if they look like the healthiest person you ever met, as potential sources of infection from blood and other body fluids. So we always follow the cleanest method, the strictest method possible, as if everyone's infected. Now, not everyone believes in that, but that is recommended. You always treat everyone as such. Dispose of everything like it's all toxic blood. If you see blood on something, make sure you dispose of it properly. Make sure you clean it properly. So on and so forth. Practice of standard precautions. Why do we do it? Ultimately, to help prevent transmission of infection to a healthcare professional, and of course to other patients, because we do multiple patients throughout the day. But number one, I want you to keep in mind, this is not, number one answer, if you see this in multiple forms, this is mostly for us, not the patients. Standard precautions. Does that make sense? It's a protective measure for all of us in this room. Once again, nosocomial, big definition to remember. If I acquire a disease in a hospital setting that falls under a nosocomial infection, there's another one I want you to add below that. It's called iatrogenic. Does anyone remember what iatrogenic means?
Getting it from a
Kind of
healthcare
overlaps, but
professional.
it's more specific.
Getting it from a healthcare professional.
Acquiring a disease from a healthcare professional is an iatrogenic infection.
Is that considered, could it be considered a tort or a lawsuit or something like
It
that?
could be. It definitely could be. Someone said that person was being unclean or unhygienic, and I got it from that person. They could investigate that.
I had a nurse come into a TB room yesterday. She didn't even tie up her contact thing, no mask, nothing. She just walked in, did the thing, and walked out. I was like, you see us with all of this on, but she thought she was Superwoman.
Yeah, or some people just get sloppy. Just to put it plain, you got some sloppy people out there.
If she sees other techs though, or other patients, and they get sick from her, like how does the hospital deal with that?
Depends on who gets infected, who wants to pursue what. They may not do anything, but it just depends case by case.
Oh, okay, so I thought you meant iatrogenic, meaning that the healthcare professional is sick and then they're getting somebody else sick, but like, you mean like somebody who's like transferring something?
Yeah, let's say I have the flu, I go to work, and I cough on grandma, who's in a bed. She gets the flu, that was iatrogenic because I gave it to her.
Oh, okay.
But if that same grandma just gets it in the hospital, it's just called nosocomial. But iatrogenic can overlap with nosocomial because it's all in the hospital. See what I'm saying? So iatrogenic is just more specific classification. Oh, okay. I have a little bit more pharmacology. Everyone's favorite subject. That's what you all do whenever I say that word. But don't worry, it's not as complex as it sounds. I've broken it down even further to the medications that you need to know as far as what they might show up in questions. So first of all, when it comes to medications, once again, contrast mediums, yes, even barium, are all considered pharmacology and actual medications. They all fall under pharmacology. So, before we use any of these things, we must know what? Of course, the patient history. Why is patient history important?
It's allergic or not.
So look for those allergies most of all, absolutely. Also, to see if they've had previous exams using that same barium or whatever we're using. Routes of administration, why is that important?
You know which medication to go through that medication.
How to give it. They may not be able to take it by mouth, so we gotta do something alternative. We gotta think outside the box a little bit, find alternative means. Purpose, why is purpose important? I gotta know why I'm using it, right? I'm not just gonna have someone chug barium because I feel like it. There's gotta be an actual reasoning behind that. Or I need a purpose or reason of why I am using gastrografin versus barium. What would be the reason? The patient has an allergy to barium. That's the purpose of using the gastrografin. And then of course the types and properties of agents, let's talk about that ionic versus non-ionic, allergic reactions. Viscosity, what's viscosity mean?
Thickness.
Thickness. Viscosity is going to apply more so for when you get into CT and MRI. For those of you that have been there, have y'all seen the contrast in the warmers?
Mm-hmm.
Why are those kept in warmers?
Thick.
to keep the viscosity
Or
down. If you were to allow that contrast to sit out on a counter for a few minutes and it gets to be room temperature, it becomes very viscous or thick. Now imagine what's going to happen if you start pumping that in someone's veins and it's very thick. It's going to be very painful. Very painful. We need it thin, less viscous. So there's going to be some stuff we've already talked about, guys, but good to repeat. Contrast mediums, most commonly in radiology, we're either going to do those as oral or intravenous. But we also have rectal contrast, do we not?
Yes.
For barium enemas, we have multiple routes of lymphedema. We also have, what's another method that we inject contrast?
Or
Through the vein.
Through the urethral, into the bladder, via catheter. We do that for contrast as well.
sister.
So I want y'all to make note, there's multiple means, but the two most common that we see is going to be the oral method and the intravenous method. Orally or parentally, once again, parenteral means an actual injection. We have the topical on the skin, subcutaneous, it's the fat layer under the skin, intradermal, it's the same stuff we just went over, under the epidermis, intramuscular, intravenous, and intrathecal. That's one I didn't mention before, I want y'all to write that down. Intrathecal has been showing up on the registry. What does intrathecal mean? Y'all have not had that yet, but it's good to go ahead and write this down. What do you think intrathecal means? We'll give you a clue. It occurs during what we call myelograms.
Back.
It does have to do with the back. It has to do with the spine, a certain specific area though.
This space.
Yeah, the space.
So, yes, it's going to be the space around the spinal cord that we call the subarachnoid space. Intrathecal injections are injected into the subarachnoid space surrounding the spinal cord. Not the spinal cord itself, the space around it, which is subarachnoid.
Where do they do it on like L spine, T spine?
Say again?
Where do they do it? L spine, T spine, or C spine?
They
Very,
mostly
very
do it in the L spine area,
Because it's
but it
thicker.
can be anywhere the spinal cord lies. But like that L3, L4 area is the most common injection site. Have you ever seen spinal taps yet?
I
It's usually where they put
listened.
the needle.
Mm-hmm.
Yes, Jay?
Isn't there an arachnoid space in the brain as well?
There is. There's a subarachnoid layer, an arachnoid layer, yes. When we're saying arachnoid, we're not talking about spiders. You know, spiders are called arachnids, not arachnoids.
Is it because it's like webby looking?
I'm not sure if that's why, but it's a good way to remember it. All right, antecubital vein. Antecubital vein in radiology is the most common injection site. That's our most common intravenous injection area, the antecubital vein. And what's extravasation again? The contrast is flowing outside the vein. That can come from a rupture or not being in the vein completely. It's introducing a tissue outside the vein, causing that bubbling you see right there.
Oh, that's how it looks.
That's how it looks. It can look much worse than that too.
So where was the that?
Likely this vein right here. That's on a child's head.
They grew up to be the Riddler.
The Riddler. Does it look like a question mark? It kind of does.
That was like a burn when you
It
burn
does
yourself.
look like a third degree. Yeah. For real.
I have a question.
Mhm.
So what happens if, like, for example, you didn't look at the patient's history and then you got like a variant of like use, but on the chart it says he was allergic to that, and you still give it to the patient and you get fired, can you sue the doctor because he was the one that made the order? Or no?
So that falls under you because you're ultimately the one acquiring the contrast. So that's why you have to recharge as well. Now, the doctor might come back and say stuff like, hey, you know, I know we're using barium, they're not allergic, but I still want to use gastrografin. That's why you document the doctor told you to change it up. But when it comes to doing oro and contrast, you're the one that's getting the contrast, you're the one that's reading the history, you're the one that's making that initial decision.
So what if there's no history there? It's the first time
If
they're
there's no
coming?
history, it's not gonna be your fault. That's why we gotta recognize the reactions, so if we see something, we stop the procedure and investigate, check our patient out.
So what is
And document, we
What is
document
C?
everything.
Contrast medium.
Why do we introduce the medication known as contrast to the body, guys? The main purpose of contrast, we should know this, that's why there's a big gold star there, is we want to artificially increase subject contrast in body tissues and areas where there's little natural subject contrast, or as we said before, into organs that are naturally translucent on x-rays. That allows us to see areas of the body that are not easily visualized in a typical x-ray imaging study, like the colon you see right there. And what kind of contrast study is that specifically? Double contrast. How do you know that's double contrast? We see white and black. Black is the what? Air, which is radiolucent. And is that a positive or negative contrast, the air? Negative. And then the barium is what color? White, and it's positive. Correct. Very good.
Is that what the transverse colon is supposed to look like?
That's a very, what type of patient?
Asthenic?
Asthenic. Remember
Okay.
asthenic, the organs fall down?
Okay.
That is quite normal, yes. I've seen people where they're, like literally even the flexures are down here. Like it almost looks like it's falling out of the body. Yeah. Like a super, super skinny person, their organs are literally falling out. But it's normal.
Mr. Funby is correct.
You see?
I think Mr. Fong's more hyposthenic. Asthenic is almost like skeletal. Like super, super thin.
You don't see that. Like
All right, so a little bit review again, guys, but just some other ways you can see these terms used. Once again, positive contrast, that's going to be our radiopaques. One characteristic I didn't mention before, please write this down, is that they have a higher atomic number. That's what allows them to be more readily absorbed by the x-rays. Higher atomic numbers of positive contrast agents. They also have what we call greater, I hope we know this term, greater attenuation or absorption. What does attenuation mean, guys?
Passing through, sir.
It's not just passing through.
Sorry.
As an
Scatter,
x-ray passes through the
absorption.
body, what happens to it?
Scatter.
It
absorption.
interacts with tissues, which is what we call attenuation, and slows down. As an x-ray goes to the body, it slows its rate and interacts with the surrounding tissues. That's attenuation. Please know that terminology. You will see attenuation used multiple times on your registry, especially in the PRE sections. Absorption is what it says, right? The actual x-ray is being absorbed into the tissues. So attenuation is more the traveling. Absorption is the actual absorption of the x-rays. What's that?
It's not allowed the x-rays to pass through.
Yeah, it's not that.
Say it again?
When x-rays are not allowed to pass through, that's not attenuation.
No, because they're passing through. It's the rate slowing down as it passes through. It's interacting with tissues. So as it's hitting tissues, it's attenuating and slowing down, causing interactions.
But they can still put their.
But we'll talk more about that. Let's get into the PRE section. So I don't want y'all to think too hard on that yet. As far as contrast goes, do know that the positive contrast has a greater attenuation factor, a greater absorption factor, higher atomic number as well, and also what we call higher radiographic contrast levels. The contrast is going to be higher on positive, which is why it's brighter, more gray, more white. Examples, of course, once again, the barium sulfates, the iodinated contrast. On the other side, negative again. Negative is what we call the radiolucent or translucent. They have a high subject contrast. They are safer and can be used in combination with positive for the double contrast studies. That's going to be things like our airs and our other gases that we introduce as needed. Most of the time, most common is going to be the air. Air is your most common negative contrast that we see, at least in radiography. Specifically the CO2. That's good.
So the negative has higher subject contrast because the black is so different between the whites and the grays.
Correct. Very good.
what you
I've
say,
seen
Reagan?
years work. Very good.
Yeah, I was looking at that.
Reagan, what you say?
I said the negative has higher subject contrast because the black is so different between the whites and the grays.
Oh, okay.
Just make a difference in the two colors. Very good.
That's what it shows for the high subject.
looks fake.
Too perfect.
That's real.
Yeah, it's real. I'm just saying. Like,
And
it looks
does anybody know? I want to see how well y'all remember this from back in Rad Pro 1.
Ooh.
So we're talking about an abdomen X-ray here. Is that patient supine or prone?
PA.
Supine.
Defend your answer, Shaneka. Why is that PA?
Is it right?
Why is it prone?
But is it right what I
I
said?
don't know. You have to defend it first. I don't know what I'm talking about. You gotta help me out.
I just said PA.
Why was that your
because
first? Why was that your first instinct to say PA?
It just looks
But why is it PA?
weird. I mean, I was looking at like the shape of the ala and that.
Thank you. That's what I was hoping you were gonna say. You said the shape of the ala. What shape do the ala have? It's indicative of prone. They're sharper looking.
Yeah, I just did this because I don't, yeah, but.
So she's correct. This patient is PA or prone. How do we know that? There are several things we can look at, but one of the main ones would be the shape of the ala. When we're supine or AP, they're much wider, more distinct. When we're PA, if y'all remember, they almost become like bunny ears, very sharp, very thin. Also, the obturator foramina stretch out and elongates versus being more horizontally oval in the AP or supine position. And you can't really see it, but pubic symphysis stretches out when we're PA. And we'll talk more about this next semester in fluoro, but the sigmoid and the rectum become more elongated as well, which is why this patient's in a prone right here. They're doing a specialized view of the sigmoid, which is this, by the way, and the rectum to stretch it out. Very good observation.
So this is a PA projection. And because the alas are showing
Sorry. Because the alas are more thin and sharp.
more thin and sharp. And what is in line, sir? You said?
I'm sorry, you hit the button. The reason that, what I said about the sigmoid is that we're doing this view to get a better view of the sigmoid rectum. That's the star of our show on sex ray, essentially. Not necessarily, that would not be a indicator, no. Because actually, the colon is closer to IR and PA. Colon in front of the spine. But whether you're AP or PA, that's not gonna be determined. You're not, it's gonna look the same as far as how it lies on the spine. I like your thinking there, though.
What about how the
More-
contrast was settling?
As y'all write, what's your question?
What
It's
about
more vocabulary, guys.
What about how the contrast was settling in the colon?
How it's saying in the colon,
That's
that
why
would more
they
so
have-
factor if we're like standing or on our side. We would see that distinct line showing the gravity. PA, not so much. It's going to be kind of just evenly distributed like an AP. You're not really going to see a difference on the contrast and how it lies in the body on PA versus AP. Only so if they're erect or cube. All right, more properties, more vocabulary, guys. Please write these down, know what they mean. Viscosity, we already said. In medication, viscosity is thickness. Toxicity, something we do not want. What does it mean? That's greater with higher concentration agents and ionic agents. In other words, the ionic agents are more reactive, huh? Yeah, I was feeling like a hiccup. Ionic agents are more reactive because they dissociate, thus causing more toxicity, which is undesirable. Miscibility, y'all ever heard that one before? It is what it sounds like, the ability to be mixed with blood. Miscibility. Use that word around the family table. Mom, can I help you with the miscibility of that cake batter?
Mix it with blood?
Yes.
It's being crazy.
blood.
That's the ability to be mixed with blood. Osmolality, that's the number of particles in a given amount of solution. Thus, once again, why they're more safe. Low osmolality agents have fewer particles in a given amount of solution and are less likely to promote allergic reactions. That's something we want, is low osmolality. That's going to be in our non-ionic contrast agents. Ionic contrast medium, once again, they have the higher osmolality. CO means contrast medium, by the way. Greater risk, maybe needed if patient's unable to use non-ionic or it's a cost option. Non-ionic has the lower osmolality, that's what we prefer to use in most of our facilities. It's safer, even though it's more expensive. especially with our elderly, our children, less chance of allergic reactions, less discomfort, but a much higher cost. And why are there less reactions on non-ionic contrast mediums? What's the chemical reason?
Because the stable atoms.
The particles stay together, they do not dissociate. Correct.
I can't believe you really have to know all this stuff.
You do. You do. You're going to be quoting it in your sleep by the time you graduate. You will be.
Some of the stuff they don't even ask you about.
It's random. You don't know what you're going to get. That's why you got to know it all, because you don't know what they're going to ask you. All right, we'll go a little faster, guys, because we'll make sure we stay on track. All right, so you said, what do I need to know as far as medications go? Here's what you need to know, guys. This list right here, just for you. All right, let's go through them. If we talk about an analgesic, what's that referring to? Something that
Painkillers,
relieves pain, such as an aspirin. That's an analgesic. Antibacterial, it's in the name, stopping the growth of bacteria, such as penicillin. Antidepressant, which I hope I don't put y'all in before y'all graduate. Antidepressant, that's going to prevent, alleviate mental depression, such as Prozac. Antihistamines. Allergies, guys. What's the most common? Benadryl. We all know about Benadryl. Do not use that to put your kids to sleep.
Yeah, people.
You'd be surprised how many people do that.
Yeah, the
I was going to
maids,
let my kids have some Benadryls, put them to sleep. Don't do that.
also
That's terrible.
babysitters and all.
That's for allergic symptoms, not putting your kids to sleep.
I use it for me.
Use it for you.
Yeah, when I want to go to
Hey,
bed,
do,
go to sleep.
do what you gotta do. What's a cathartic? That's another word for a laxative. What are laxatives, guys? That makes you go poo-poo.
Ooh, yes.
To use a kitty term, makes you go poo-poo. Such as Visacodil. Laxative, like if you have a very hardened stool and you can't use the bathroom, you'll take a cathartic. Diuretic is going to be something that stimulates urine, such as Lasix. You probably heard nurses say, give them like 2 cc's of Lasix. Stimulants, something I'm drinking right now, caffeine. Stimulates the central nervous system, CNS. They can also be amphetamines. Do not take amphetamines,
What's
like
that?
meth. Not amphetamines.
Oh, the drugs.
Unless you want all your teeth to rot out and you want to turn into a zombie. That's what my 2 adopted children's parents were, was meth heads.
Are they
Big,
clean
big
now?
no.
Or?
Of course, a lot of these narcotics, medical facilities use them in different capacities.
Are they clean now?
Are they clean?
Probably don't know.
Like,
No, they're not clean. An amphetamine, that would be used for a very specific like condition or procedure where they have to like stimulate something with the CNS. It's going to be used very carefully because obviously very habit forming, very addictive, and can really wreck your entire body. If you don't know what I'm talking about, you ever just want curiosity to look at a meth head, look at someone who, they have pictures, someone before they started taking meth and someone after they started taking it. They look like a zombie, like they decay. Like just literally like cause you to rot from the inside out. Horrible.
Like the Home Alone kid?
Yeah, like Macaulay Culkin, good example. Tranquilizers. Do not take tranquilizers before your test because you're not going to have anxiety. That'd be something like diazepam. That's for reducing anxiety. Tranquilizers. And a vasodilator, my wife takes. She takes vasodilators to relax and dilate the blood vessels, decrease blood pressure, things like nitroglycerin and verapamil. She takes propranolol. My wife takes propranolol. It's a vasodilator.
So,
Yes.
the blood pressure medications are vasodilators.
Yes.
So what?
Unsee?
The diuretic, I think you said it absorbs water.
No.
It can't. So
Expels. It helps you expel it.
Yeah, you
it
said
makes you
to go.
makes you have to go more.
Yeah.
It can cause dehydration. So I think the common misconception is that people say a diuretic causes dehydration. But why does it cause dehydration? Because it makes you urinate more,
You clean it out.
flushes you out more.
Take
Thus,
more.
you become more dehydrated.
She said,
I may have misspoke earlier. It's not absorbing the water. It's stimulating you to go more. Which is why, you drink a lot of coffee, you gotta go to the bathroom a lot. You drink a lot of tea, you gotta go to the bathroom. You drink an energy drink, you ever drink an energy drink on the road, you gotta like stop every 10 minutes because it just goes straight through you? Am I the only one that happens to? I guess so.
They call
Oh, it's just water weight, but I don't think it's water weight.
It's one of those silly things people say.
I take it faithfully.
Is metropolol also one of those vasodilators?
What's it called?
Metropolol. I've
Yes.
noticed they use it a lot in CT.
I think so.
The metropolol is a blood pressure medication.
I can't believe y'all didn't laugh at my joke. I like that one. If oxygen's a drug and we're all high.
Man, if it was.
The oxygen is a drug.
I crank it up.
That's the irony of the meme. The oxygen is considered a drug, guys. Why? Because we can prescribe oxygen to somebody. Anything you can prescribe can be considered a drug. And you can have too much oxygen. So I will tell you a funny story. This came from a student way back when I was first starting. I was having a patient care class. And I was talking about oxygen being a drug, and she spoke up. She said, "Does that mean we're all high right now? Because we're all breathing in oxygen, right?" And for some reason, it just got my funny bone. I just could not stop laughing. I had it in class. I just could not stop laughing. Something about the way she said it, because she was so innocent when she said it, like out of concern, I just could not stop laughing. I had it in class.
Would you call her a narc?
So you're ending class.
Huh?
You call her a narc? Like,
Narc?
why were you laughing so hard?
Is it a narc a tattletale?
That's a
You said she was like so
Snitch,
innocent. Yeah, she was so innocent. Like it was it just caught you off guard.
It just caught me off guard. I think it was the combination of how innocent and sincere she wasn't asking it, and just her facial expression. Because she was so genuinely concerned that she was high from being an oxygen. We'll start laughing about it. I picture her in my head. But I don't know. It got me. It got me.
So the first and last drug a human takes is oxygen.
What?
The first and last drug a human takes is oxygen.
I like that. It just depends if you get any medication while on the moon, but that's actually kind
Can you do
of.
that to a baby? You could inject medication.
That's actually, I like that, John. It's the first and last drug we take is oxygen. That's like one of the lead statements there. We will write that as a quote. There's your class quote right there.
That's our class theme?
Okay, guys, so medical emergencies. Vomiting, like you see in that beautiful gif.
Girl.
If you have kids, you probably lived in vomit like I have. Our camping trip, I was swimming in vomit. I told you our camping trip, everyone was throwing up. Yeah, so vomiting, what do you do, guys? I kept this simple. What's the first thing you should do if someone's throwing up? Turn. Call for help. What do you do for the patient? I was like, help, I can't handle vomit. Turn the patient's head to the side. Why? To prevent choking or aspiration of vomitus. By the way, it's called vomitus. I won't stay up for a long time. Fractures.
You're gonna be cleaning up this vomitus.
So this says no different types of fractures, but we're gonna retread this a little bit later. So keep that in the parking lot. We do need to know different types of fractures and how to respond to them. That's something we review in Red Pro 4, so that's coming later. Spinal injuries. Guys, what have I harped on about spinal injuries? This statement right here.
Always take off.
Do not remove the seat collar, but must not be moved unless in the presence of a supervising physician team to assist. Do you ever move a spinal patient by yourself? You do not. I don't care what that tech has told you. Do not ever move a spinal patient by yourself. This has been showing up on the registry. Epistaxis. Nosebleeds. There's still a word for nosebleeds. Please just write that down. Don't identify that because you have to know the response to a nosebleed. What do you do if you have a nosebleed?
Put your hand forward.
You do not. I was hoping someone was going to say that though. Because when we were all kids, we always learned to do this, right?
Yeah, that's true.
Why is that not allowed anymore?
Which is true.
It's a choking hazard. The blood flows down your throat and the clots go down your throat. Because you get blood clots, you can choke on a blood clot. What is the proper modern way to deal with a nosebleed?
But you lean forward and you pressure.
Apply pressure and you lean forward. That way it's going to flow naturally while you're still trying to clot it up. Please write that down because one of your answer choices will be tilt the head back. I know for some of us as kids, we learned that. That's what they taught me in elementary school. That has been updated. We do not do that anymore. Head forward while applying pressure for epistaxis. And I'm not going to say nosebleed, by the way. I'm going to say epistaxis. So you got to know what that means. Nosebleeds are horrible, by the way. I used to have them all the time when I was younger.
Why does that happen?
Usually if you have like an exposed little artery in your nose, and it just like gets, like you blow your nose and you rub it wrong, and it just ignites the waterfalls, I used to say. I used to get nosebleeds horrible when I was a teenager, and they just finally stopped. But man, every time it'd be summertime, I would just brush my nose and just be like, like just come flowing out. Huh? It didn't hurt, it was just annoying. Yeah. No one else had nosebleed issues? I used to have them a lot.
My younger brother has it bad.
I'm the only person with any of this stuff I keep talking about. Okay, it's all right. I like being unique. It's all right. All right, some more guys. Postural hypotension. That's a decrease of blood pressure that occurs on rising to the erect position. What's another word for that? Orthostatic hypertension. It's a synonymous term. Vertigo. Anybody have vertigo in here? I have vertigo. Once again, I guess I'm the only one. The sensation of the room spinning. If you have inner ear problems, it can cause you to get very dizzy, be off balance, and lots of nausea. I have vertigo. So y'all see me get off balance sometimes up here? That's because I have vertigo.
Help.
Does that stem from the cochlea?
Usually, yes.
If I had put my head too low,
By the way, this is why I can't ride theme park rides hardly anymore. I get on something that spins, I'm done for the whole day. It messes me all up.
Me too.
The teacups are the best.
Huh? Cochlea. Not cochlea.
so I don't need
Y'all need a quick break?
Yeah.
All right, quickly, guys, because we still have a few more slides to get through.